Welcome to This Explainer. Today, we're diving straight into the fascinating, totally invisible mechanics of human behavior. We're drawing directly from Dr. Sarah Butter's incredible medical lectures at Ulster University on conditioning and learning. I mean, if you've ever wondered why you instinctively crave a snack at a very specific time of day, why a random smell just brings back a flood of memories, or even why some physical pain lingers way after an injury is healed, well, you are in the exact right place. We're going to decode the psychological software that runs our lives. Here is our roadmap for today. First, we'll cover the foundations of learning. Then we'll explore classical conditioning and building associations, followed by operant conditioning and facing consequences. After that, we'll take these academic concepts straight into the clinic, and finally, look at shaping better health. All right, Section 1, the foundations of learning. To really get a grip on this, we have to travel back to the early 20th century and look through the lens of a psychological movement called behaviorism. Behaviorists believed that to really understand humans, you shouldn't try to guess what's happening inside their minds. Instead, they focused purely on observable, quantifiable behavior. So, the crucial starting point is how we actually define learning. When we hear the word learning, we usually think of sitting in classrooms, memorizing textbooks, or maybe picking up a new language, right? But medically and psychologically speaking, learning is defined as any experience that causes a permanent change in our behavior. It's literally an automatic updating of your biological software based on what you encounter out in the world. To understand how these permanent changes actually happen, we're going to examine two major schools of thought side by side. First, we have classical conditioning, which is learning by association. And second, we have operant conditioning, which is learning by consequences. Honestly, almost everything you do, feel, and react to traces back to one of these two pillars. Moving on to Section 2. Classical conditioning and building associations. This theory is all about predicting the future. It's how an organism acquires the knowledge that certain events will reliably follow other events. You've probably heard of Pavlov's dogs. Well, before conditioning, food naturally makes a dog salivate, right? But a tuning fork, that does absolutely nothing. During conditioning, Pavlov played the tuning fork right before giving the food. He introduced predictability. Over time, the dog's brain made the link. And after conditioning, the tuning fork, a completely neutral stimulus, triggers the salivation all on its own. The dog has learned purely by association. Let's break down the actual mechanics here, because the terminology can be a bit much. It always starts with the unconditioned. These are things that happen naturally without any training whatsoever, like food causing salivation. The real magic happens when we systematically transfer that natural reaction to a brand new conditioned trigger, like the tuning fork. Your brain is essentially a highly efficient prediction machine, constantly preparing your body for what's coming next. Now, check out the life cycle of a conditioned response. It's kind of like a roller coaster. During the acquisition phase, the behavior climbs as the association is learned. But if you keep ringing that tuning fork without ever giving the food, the behavior drops off. That's a phase called extinction. However, here's the crazy part. The brain never truly forgets. After a pause, the behavior can experience spontaneous recovery, just seemingly out of nowhere. Okay, Section 3, operant conditioning and facing consequences. This pillar is built heavily on the law of effect, which states a very simple, undeniable truth. Behaviors that produce a satisfying state of affairs are repeated, and behaviors that produce unpleasant ones are avoided. So, mapping out the brilliant work of B.F. Skinner and Edward Thorndike, we absolutely need to clear up some terminology that trips people up all the time. In psychology, positive does not mean good and negative does not mean bad. Positive simply means adding a stimulus and negative means removing one. Reinforcement always aims to increase a behavior and punishment always aims to decrease it. So, negative reinforcement? That's not a punishment. It's actually encouraging a behavior by taking away something annoying, like taking a pill to get rid of a headache. And we can actually supercharge these consequences using different schedules of reinforcement. You don't have to reward a behavior every single time to make it stick. Take the variable ratio model. This is essentially the slot machine. Because the reward comes after a completely unpredictable number of tries, the brain gets obsessed. It keeps repeating the behavior furiously, hoping that the next pull is the winner. It's literally the most powerful way to maintain a behavior. Which brings us to Section 4, Psychology in the Clinic. This is where academic theory hits the real world and where this explainer gets incredibly practical. Because learning theory isn't just for dogs and slot machines. It fundamentally alters human patient care. Whether you're sitting in a doctor's office, a hospital bed, or a physical therapy clinic, these invisible forces of conditioning are swirling all around you. They're actively shaping your health, your healing process, and as we're about to see, even your physical perception of pain itself. Let's apply classical conditioning directly to a patient's back injury. This sequence is truly remarkable. The initial injury naturally causes pain, right? But over time, contextual cues, like the specific physical motion of bending forward or even the clinical environment of seeing the physical therapist, get repeatedly paired with that pain. Eventually, those neutral things become conditioned stimuli. This means a patient might actually feel enhanced physical pain just by walking into a clinic, simply because their brain has classically conditioned that context to predict bodily harm. The expectation of pain actually creates it. On the flip side, we have the operant model, which perfectly explains chronic disability. Think about pain behaviors, things like grimacing, resting in bed, or missing school. When a child stays home sick, they might receive extra sympathy and attention from a parent, which is positive reinforcement. They also get to avoid their homework, which is negative reinforcement. The end result? These pain behaviors are powerfully reinforced and can be maintained long after the actual physical tissue damage has completely healed. Finally, Section 5, Shaping Better Health. Medical professionals don't just use these concepts to figure out why illness persists, they actively deploy them to shape better health outcomes. We see conditioning literally everywhere in health. Take addiction. It's a dual-layer trap. Classically, simply walking into a pub triggers a learned craving. Operantly, drinking is positively reinforced by social confidence and negatively reinforced by wiping out withdrawal symptoms. But doctors can flip this script. For example, the drug antabuse intentionally induces intense sickness if a patient consumes alcohol. It's artificially creating a powerful, classically conditioned aversion to break the cycle. But hey, it's not always about severe, heavy interventions. Sometimes the absolute simplest operant conditioning techniques are the most effective. Research has shown that something as basic as a sticker reward scheme, a literal positive reinforcement chart, significantly improved hand hygiene compliance among adult healthcare workers in hospitals. Praise and token gifts fundamentally alter human action, whether you're a child eating vegetables or a highly trained medical professional. And we can actually scale these concepts up to the entire population. Public health initiatives are essentially mass conditioning experiments. Increased taxes on cigarettes? That is positive punishment, adding a financial sting to decrease a behavior. Paying pregnant women to give up smoking? Pure positive reinforcement. And when therapists slowly expose patients to their phobias in a safe environment, they are systematically driving the extinction of a conditioned response. So as we wrap up this explainer, we really have to look at the massive implications of Dr. Butter's material. From the ringing of Pavlov's tuning fork to the complex pain pathways in a modern medical clinic, we are profoundly shaped by our environment. It forces us to ask a really big question. If the things we feel, the habits we hold on to, and even the pain we experience are simply the permanent changes of conditioning, just how much power do we truly have to unlearn our most stubborn health challenges? Thank you so much for joining me, and I really hope this changes the way you look at your own behavior.